Well, you know, there are runs and walks and golf outings and all that stuff for every other ailment out there. Now it's time for wound care. The Ouch Race is a new one going on this Saturday. And Dr. Greg Bohn is here with all the info and a couple of props to kind of show what this is all about. Nice to have you here, Doc.
Well, thanks, Paula.
Yeah.
Thanks for having us.
This is the first time we've had, a wound care awareness walk or run or race here.
That's correct. There really isn't a wound care charity, and it comes out of work with some friends of mine from some of the national meetings that we've done. We went to Haiti this last year. Everyone heard a lot about that, and we wanted to do more, but also recognize that there's a lot to be done here in our community. So this is kind of the culmination of about 2 years of my efforts here locally to raise something, and also some efforts that are going on nationally.
Well, I know that people with diabetes will be more familiar with this than others maybe. What are we talking about when we talk about wound care, a problem with wounds that don't heal?
Well, people don't realize what a problem it is because people don't talk about it. It's kind of like breast cancer was back in the 80s. People didn't talk about it. But what I didn't realize as a surgeon before I got involved in the wound care program was that patients who suffer an amputation as a result of a wound can have as high as a 45% 5-year mortality. That's like colon cancer and some of the other things that we treat. So it's serious business and serious problems.
And they need props like special inserts in their shoes.
Yeah.
This is an example of is it just the insert?
Well, no, it's a special diabetic shoe, so it's built up on the inside to accommodate a special insert like this to take pressure off their feet.
Yes.
Diabetics develop neuropathy, so they can't really feel the bottoms of their feet, and they can get injured, and this is a way to protect them.
And these kinds of shoes and inserts and orthotics and these boots, these things aren't inexpensive, and insurance doesn't always cover them.
No, they don't. A lot of governmental programs and insurance don't cover these things, and for our uninsured and underinsured populations, they're out of reach. I've got one woman that I take care of. Her decision was whether to spend money on insulin for her diabetes or to buy food for the table, and we've solved the insulin problem, and we've got that taken care of. But she doesn't have extra money for this and these kind of things. So having some money available to us will go a long ways to help preventing these types of injuries.
And that's what the event is about this weekend.
That's
so
right.
We need to tell everybody what it is. There's the 5K.
There's a 5K event. Mayor Freemeyer is going to run that for us.
Good.
And then Barb Bates-Jensen, who's professor of nursing at UCLA, who's one of the friends that helped develop this. This is actually her foundation now, the UCLA Bates-Jensen Wound Reach Foundation. She'll be here to run the half marathon.
All right.
So.
Well, the point is the awareness on this and the money that will be raised for these kinds of materials that are needed. Right?
Correct.
Saturday at 7 is when we're going to kick this off. And, a first-time event, it's always tough to get the word out and get people to show. But, you're hoping for a few hundred.
Yeah, in the Quad Cities, since I've lived here, has been a great community. I mean, it's a very charitable community. Whenever anything like this comes up, people show up for it.
Yes.
And I'm counting on that generosity and that kind of Midwestern hospitality and kindness to kind of help get us to where we need to be.
To Bettendorf Trinity.
Bettendorf Trinity. Anybody from the Quad Cities, we take care of patients all around the Quad Cities. We've got a center in Davenport, or a center in Bettendorf and one in Moline. So
good to have you here, Doctor. Thank you so
very
much.
much.
The Ouch Race.
The Ouch
Saturday.
Race.
Yes.
Yeah, bring your Band-Aids.
I know, and say ouch. When we